Aloha, everybody, and welcome to another edition of the Weekly Dose. I'm Brooks Bear. I work for the Department of Health, and today's guest here on the Weekly Dose is none other than the Director of the Department of Health, Dr. Libby Char. And Dr. Char, thank you so much for taking the time. I know you're extremely busy, but we've got important stuff to talk about.
Good morning. Nice to be here.
We are 4.5 months into Hawaii's COVID-19 vaccination effort. How are we doing?
I think we're doing pretty well. We have administered 1.2 million shots, and 47% of our adults in the state are fully vaccinated.
We're on our way. And we now have 3 products back on the market, not only the Pfizer and the Moderna, but the Johnson & Johnson is again available after that 11-day pause. Johnson & Johnson allocations or vaccinations resumed this week. How did that go?
It was interesting. We actually had people that were waiting during the pause so that they could receive Johnson & Johnson, knowing that it would be back. I was kind of surprised, but pleasantly surprised. It's a safe vaccine. It works well. The first day that it was available on Maui, all 300 appointments were snatched up. And similarly on Oahu, I think it was about 365 doses were administered as soon as it was available. So we're doing well. We have 3 vaccines available for people. They can get either the Johnson & Johnson, the Pfizer, or the Moderna, and we're making all 3 available to people. It's their choice.
Vaccines are now easier to access and more available than they've ever been.
They're definitely available, and we've been working really hard to make it available to people and to make it easy for them to go and get vaccinated. We have appointments that are available. You can do it online. We're helping people that are not used to doing things on computers by having a telephone line that we can help them make appointments. We have walk-in clinics now. We have several pods that are doing outreach into the communities to try and encourage people to get vaccinated. And we've also decentralized. We're going to be closing a couple of the community pods and shifting to the decentralization. We still have a bunch of pods out, I believe Queens West. We have pods available in the Kapolei Theater done by Kaiser. And we're just partnering with the community. We have pods in the pharmacies as well. And that's a real key. So in your neighborhood pharmacy, you can go and get a dose of your vaccine. So we're just trying to make it really available to people and make it very easy for them to get vaccinated.
Yeah, I guess it's all about access, right? And the pharmacies are a wonderful component because they're in people's neighborhoods, they're close to home. Hopefully that makes things easier and more accessible to people. And some of the larger locations that people have become familiar with, the Blaisdell and Pier 2 as another option. And the Department of Health has had its own vaccination pods working. The Department of Health has been running the pod in Kaneohe at Windward Community College, also partnering with the city at Leeward Community College for that pod that has seen just thousands and thousands and thousands of people come in and get vaccinated. And then in the last few weeks, there's been a location where people could get vaccinated thanks to a partnership between the Department of Health and Times Pharmacy up in Mililani at Rec Center number 5 up there. But those locations are going to be shutting down in the middle of May. What's that all about?
Well, so as we were saying, we're just trying to decentralize a little bit, closing those down, but doing so because we know that vaccine is now available to people, where they work, where they live. So it's really easy for them to get it. And so we can, push people towards those locations where it's just so convenient and they have a fair amount of doses. And we're just kind of shifting to make sure that we're accommodating people and trying to make it as easy as we can for them.
So people have access now, and there are actually lots of vaccines out there. Early on in the vaccination effort, it was kind of, when's my turn? When's my turn coming? When's my turn coming? Well, your turn is now.
Yeah, we'd like to encourage everybody to make an appointment or go to one of the walk-in sites. Just get vaccinated now. We still have a pretty robust uptake of vaccines. and we're still doing a lot of vaccines every week, but we just want to encourage people to keep that up, keep moving forward, and we need to get to that herd immunity.
Right. That's the ultimate goal. So I guess the message now is, why wait? I mean, if you're one of those people that's kind of been thinking, I'm busy, I'm going to do it, but I'm going to do it when the time is right. I guess we're saying the time is right. Do it.
Absolutely. And, it's going to become more and more important in the future, especially if it is tied to things like, get your vaccine and keep that vaccine card, because that may be something that becomes very useful if you want to travel in the future. Just things like that. It's going to be more and more important, and just to keep yourself safe and your community safe. Please go get vaccinated. We still have cases of COVID. We had over 100 cases, new cases on Sunday. So we're still seeing COVID. We're not out of the woods yet. And the faster we can get people vaccinated, and the more people we can get vaccinated, before we really have a shift with variants, it just keeps everybody safer.
Okay. Lots of vaccine out there, accessible, more accessible than ever. And you've got your choice of the Pfizer, the Moderna, the Johnson & Johnson. What other important things should we know about the vaccines as we march toward, past 1 million, past 1.2 million, and hopefully in the next several months, we reach 2 million shots administered? What else is important to know?
Yeah, we really want to get there. We know the vaccines are safe. We know the vaccines work. We have seen a significant decrease in the amount of people requiring hospitalization. And we have seen a decrease in the number of our kupuna that are getting infections. So we know that the vaccine works, and it's not 100%, but even those who are becoming, who are testing positive and who are getting COVID after they've been vaccinated, it's a very, very small number. And thankfully, we're not seeing very, very high rates of hospitalization or really severe illness in those people. So the vaccine's safe and it works. And that's really the point, is, to protect yourself and protect others.
And I had someone tell me, we were discussing the vaccine, and this person was, reading some things that just aren't true. And one of the things was, boy, if I get that shot in my arm, that thing is in me forever. That vaccine's in me forever.
Yeah, actually, I was listening to one of the podcasts the other day on the radio. I was driving, just happened to hear it on the radio, and it was This American Life, and they had, it was an interesting segment, but there were 5 things that I wrote down from Dr. Tom Frieden, and he's the former director of the CDC. Dr. Frieden is an infectious disease doctor, and I just thought he said it so well. So I actually, went back and listened to the podcast later when I could sit and write it down. And I jotted down kind of five facts from him that if you're okay with it, I'd like to share those 5 facts with you. I just thought he said it so well. It was so easy to understand. So number 1, he said, if you get COVID, it will go all over your body and stay there at least a week. And the effects will be much more likely to cause you long-term problems than the vaccine. The second thing he said is kind of what you were alluding to. The vaccine primes your immune system, and then it's gone. It will not be with you anymore. The third thing he said was that more than 95% of the doctors who have been offered this vaccine have gotten it as soon as they can. Fourth thing he said was, the more we vaccinate, the faster we can get back to growing our economy and getting jobs. And the fifth thing he said was, if people get vaccinated, we will save at least 100,000 lives of Americans who would otherwise be killed by COVID.
And one of those people might be someone you know. And even if it's not someone you do know, you're doing the responsible thing for people you come in contact with, and becoming part of the solution by getting vaccinated. So 5 fun and factual facts from the former director of the CDC, and delivered to you by Dr. Char. Dr. Char, we appreciate your time. Thank you very much. Look, we don't have a magic number for herd immunity. I think the important thing is that we just all get vaccinated, because there's no magic number. It's about doing our part and doing our thing. and continuing to do what I will do at the end of this segment, which is put this baby back on.
Yeah, and I think we just need to remember that the vaccine is another layer of protection for us, and there are many. And so wearing our masks, avoiding large gatherings, getting vaccinated, you know, those are just all different layers that we build into each other. Nice talking to you, Brooks. See you soon.
All right, let's mask back up and let's call it a day. Dr. Elizabeth Char, Director of the Hawaii Department of Health, our guest this week on the Weekly Dose. Everyone, we appreciate you very much watching, and we appreciate all you do to stay educated on what's happening with COVID-19, what's going on with the vaccines, and most of all, thank you for doing such a great job of protecting yourself, protecting your family, your neighbors, your coworkers, your community, and all of Hawaii. Boy, I'll tell you, with every passing week, I feel more optimistic about where we're headed. Yeah, we're not at the finish line yet, but I'm feeling like we can get there. We're going to get there. So thanks, Hawaii. Thanks for watching, and we'll see you again soon here on the Weekly Dose.